Beautiful shot of the Capitol. Look at that blue sky on a Sunday here in Washington, mid-September. Joining us now, three members who work in that building. Three members of the United States Senate, Democrat Jeanne Shaheen of New Hampshire, and Republican Susan Collins of Maine, and Democrat Dianne Feinstein of California. Welcome. Let's start with the health care debate. And I'll start with you as the Republican at the table. The president gives a big speech. One of the goals is to bring Republicans on board. More likely or less likely after that speech to join the Democrats?
Well, I don't know that the speech really changed the dynamic, but I was glad that the president has followed up with some individual meetings and bringing people together. I believe all of us want to see a bipartisan bill. That obviously would be the best approach. But what's in the bill will determine whether
you have said, Senator Collins, you don't want a public option.
That's right.
What about a trigger? Would that be acceptable if you have maybe co-ops and you see if competition takes place, but there's a trigger in there if 2 or 3 years down the road that hasn't happened, then the public option kicks in. Is the trigger acceptable?
No. The problem with the trigger is it just delays the public option because the people who are going to be making the determination about whether the market's competitive enough want the public option. So I think the trigger is just a delay.
Senator Shaheen, you were in the meeting with the president the other day and this issue came up. You were a supporter of the public option. Did you tell the president, sir, we can't get it, it's time to move on, or do you want to fight for it?
I am a supporter of the public option. I think that's a reasonable way to go, but I think it's important to stay focused on what we're trying to accomplish. And the president pointed this out in his speech. We want to get competition in the health insurance market. We want to make sure that people who can afford health insurance are going to have an affordable option that they can use. We want to improve health outcomes for people, and we want to long-term lower the cost of health care. So I think keeping our eye on what we're trying to accomplish, what our goals are what we need to do. There are a number of ways to get there, and we need to keep focused on the goal.
If we keep focused on the goals, though, Senator Feinstein, you have been here before and reporting when you go home, people are worried about how much this is going to cost. The president says $900 billion. He promises it won't add a dime to the deficit. He says he can squeeze from Medicare and Medicaid most of the money he needs. Does the math add up to you? Have you seen enough details to convince you, yes, I can sign on to that math?
Well, for the first time yesterday, I met with Finance Committee staff and White House staff, and for the first time did see some of these details. And yes, I believe it is possible to put together a bill which does not adversely impact the deficit and may, I say may, even reduce it over time. Important to me is, one, that you have insurance reform, major insurance reform, and that's not easy to accomplish, but it can be. Secondly, that you have the individual mandate in a way that it does not create another entitlement. Thirdly, that you don't just simply push the costs onto the states. I have a huge state unable to bear more cost. And if you can do these things, I think we've got a very good chance to put together a bill.
Senator Shaheen, let me come back to you. Senator Collins says she can't support even a trigger. So does the president have to make a decision if a moderate Republican voice like Senator Collins, who is known to try to deal with Democrats who voted for the stimulus, if she can't support a trigger, does the president has two choices? One, give it up, or two, do this with all Democrats? What should he do?
Well, first of all, I think that we're going to have a bill that has significant bipartisan input, regardless of how the votes come out. The bill that came out of the Health Committee in the Senate had 167 Republican-sponsored amendments that were adopted. So there has been significant Republican input already into the legislation. And, you know, I think we can do what Senator Collins would like to see us do, what others in the Senate have said they would like to see with a bipartisan bill. We can lower costs. We can improve health outcomes. Senator Collins and I have legislation that I think is going to get incorporated into the Finance Committee bill that would lower Medicare costs for people who are hospitalized. We know that a number of them go back into the hospital within 90 days. We can reduce that number. We can save $5,000 per Medicare patient. We can make them healthier, and those are the kinds of improvements we want to get into any health care bill.
I want to get up for a second and walk over to the wall here, because as we discuss the substance of the health care debate, I want to show you something that I found stunning about the politics of the health care debate. And I'm going to pop this graph up here. This is our latest polling. Approve or disapprove of the president's handling of health care policy. And the number that jumps out at me is this one right here. Senator Collins and Senator Shaheen especially, Senator Feinstein from California, are from states with a great number of independents in them, in some cases more than Democrats and Republicans. 61% of independents, 61%, now disapprove, Senator Collins, of the president's handling of the health care issue. Your state has more independents than it does Democrats or Republicans. How did the president lose all those independents?
Because he did not initially focus on cost. That is the #1 concern as I talk to my constituents. They're concerned that we may be creating an expensive new entitlement program. They're worried about the amount of debt that we already have accumulated. They're worried about the expansion of government's role in the financial system, in the automobile industry, and now in healthcare. They're very concerned that we're not dealing with the #1 issue, and that is the escalating cost of healthcare.
If that's the case, Senator Feinstein, and there's a credibility question out there with the American people, can we afford this? I think in post-Katrina America, a lot of people just think the government can't do anything big and get it right. Should the president do this incrementally? Maybe take this legislation, take other legislation, prove that you're bringing down costs, and do this in pieces, or do you have to do it in one big sweeping bill?
I tend to be an incrementalist when I look at huge programs. It's very difficult to remake 1/6 of the American economy at a time of tremendous economic angst out there. So I think that's part of it.
Why doesn't the president disagree with you?
Well, but I think the way, now I'm talking about the Finance Committee bill, because I actually think that's the bill that is going to matter greatly in the Senate, and they have Medicare and Medicaid jurisdiction. Medicare begins to run out of dollars in 8 years. So the entitlement issue that Susan mentioned is really a very important one. And I won't vote for a bill that creates a new entitlement. We pay this year, over 1/2 of all the dollars go just to entitlements: Medicare, Medicaid, Social Security, veterans benefits, and they are going up. If you add interest on the debt, you come up to about 56% of every dollar is spent that way. This long term is a very, very unsustainable system. So we've got to make these reforms. So the key is that cost curve, not that it goes like this, but that it continues to go like that in the out years. And that will be the test of the bill that the Finance Committee puts forward.
I want to move to overseas issues facing the president. One of the biggest challenges is whether to send more troops into Afghanistan. We saw 5 Americans killed just this weekend. The death toll has been going up. Among the leading Democratic voices on foreign policy is Carl Levin, the chairman of the Senate Armed Services Committee, who says before he will agree or support sending in any more troops, he wants the president and the United States to do a better job getting the Afghans up to speed. Let's listen to Senator Levin.
We should increase and accelerate our efforts to support the Afghan security forces in their efforts to become self-sufficient, delivering security to their nation, before we consider whether to increase U.S. combat forces above the levels already planned for the next few months.
Senator Collins, you were there recently. You have been at the Pentagon to be briefed on the plan. My understanding is you've also had a conversation with Secretary Clinton recently about this issue. Is Senator Levin right? Do we need to do more to train the Afghans before sending another U.S. boot on the ground?
Well, he's certainly right that we need to increase the size of the Afghan army. When I was in Afghanistan, I was appalled that in one of the most dangerous sections in southern Afghanistan, we had 10,000 American Marines and only 800 Afghan troops. That's just not right. So he's right that we need to build up the Afghan army, but I'm going to await the recommendations of General McChrystal, in whom I have a lot of confidence, before making a decision on troops. I will tell you, having spent 2 days there just last month, that I just don't know that more troops is the answer. We clearly need more American civilians to help build up institutions. We need to grow the size of the Afghan army, but we're dealing with widespread corruption, a very difficult terrain, and I'm just wondering where this ends and how we'll know when we've succeeded.
Well, Senator Feinstein, you're the chair of the Select Committee on Intelligence. To the question of where this ends, it is 8 years after 9/11. We paused and reflected on that just the other day. You see the things that we can't see, the intelligence. Are we winning in Afghanistan? Are we any closer to finding Osama bin Laden? And does the president have a clear strategy in your view?
Well, I can tell you this. A lot of the leadership has been taken out of al-Qaeda. I can say, and I think you would agree, that Afghanistan and the Pakistani border are still the safe haven, the major safe haven for terrorists in the world. And these are people who will, if they can, come after us, not necessarily the Taliban, but certainly al-Qaeda and other affiliated groups. So we have to consider that. We have about 60,000 troops there. Another 8,000 are moving in. With our allies, it about equals the force that is in Iraq. To the best of my knowledge, the president has had no request for additional troops up to this time. My view is that the mission has to be very clear. I don't believe...
Has to be means it's not now.
I believe it is not now. I do not believe we can build a democratic state in Afghanistan. I believe it will remain a tribal entity. I do believe that clearing out al-Qaeda, clearing out the Taliban is a bona fide part one of the mission. I do agree that training Afghan troops, Afghan police is an important part of the mission. I believe the mission should be time limited, that there should be no well, we'll let you know in a year and a half, depending on how we do. I think the Congress is entitled to know, after Iraq, exactly how long are we going to be in Afghanistan. So there's the mission and the time, and from an intelligence point of view, I think gains have been made. I think the use of drones have been effective in terms of targeting leadership with careful intelligence. I think that's been one of the unsung successes.
All right, Senator Collins, Senator Feinstein, Senator Shaheen, you're all welcome back anytime right here as the health care and other debates go forward.